Hello, my name is Temitope Banjo. In this video, I'm going to be demonstrating sterile gloves and Foley catheter insertion. Um, to start with, I have been able to verify the PCP order with the patient care plan, and I've been able to affirm that the information stated is rightly documented. And next thing is I've been able to gather supplies and equipment that I will use. I have here a pack of sterile gloves, intact, checking for integrity. The expiry date is August 2022. There is no rip of any form, no tear, is intact. And I have a pack of Foley catheterization tray with the expiry date in March 2022, intact, no rip, no tear of any form. The two equipment and supply are good to use according to what they have in the order. Now, the next thing I will do is I'm going to perform hand hygiene, and I'll be putting on a clean glove. While doing this, I'm going to my patient. Hello, how are you? My name is Temi. Can you please verify your first and last name for me? Jackie Smith. Thank you, Miss Jackie. Can you please verify your date of birth? 03/07/1972. Perfect. Miss Jackie, my name is Temi. I am a student nurse. I am here today to insert your catheter. Is that okay? Good. Before I go on further, I've been able to provide privacy. I'm going to be asking her two questions. Miss Jackie, are you allergic to latex? No. Betadine? No. You're good? Fine. Okay. To let you know that we're going to be inserting your catheter like I told you. It's not going to take much time. Not going to spend too much time here. It's just going to take a few minutes. Is that okay by you? If you feel any concern in the course of doing that, please let me know. I have been able to adjust our bed, and I'll be placing my patient in a dorsal recumbent position so that I'll be able to have access to our perineal area. And I'm going to make sure I open her legs in order for me to have enough area to work with. But I'm going to cover the part of our body, only the perineal area which I'm going to work with is where I'm going to open. Now, having done that, I'm going to quickly do something to get you prepared. I'm going to put a waterproof pad under my patient. Miss Jackie, one moment. And I'm going to wipe the area with a clean towel. Wipe the area with a clean towel. Okay. I've been able to wipe the area. So I'm going to take off the pad and the towel. I'm going to take it off. So after doing that, I'm going to take off my hand glove. I'm going to wash my hands and perform hand hygiene. Now I've been able to perform hand hygiene. I'm going to go to the sterile section. Before I can do anything sterile, my patient is rightly placed. I just want to let us know that the surface I'm working with is wiped clean, and I'll be pretending for the sake of this video that I'm working within my hips and my shoulder. I won't be going beyond my hips and shoulder because sterility rule says we should work within the two areas I mentioned. So the surface is clean and I'll be working within hips and shoulder. Now I'm set. I've been able to verify my equipment and check for the integrity. The two equipment are good to use. So the first thing I'll be doing is I'm going to be opening the Foley catheterization tray. While I carefully open the catheterization tray, I'm going to keep this bag as a trash so that I won't be going front and back for trash bin. Though I have one there, but here I'm going to place this one by the bedside so that I will easily drop my trash inside. I do not need this, so I'm going to take this off. Then I'm going to open the pack without touching anything inside. Carefully, I'm going to open this. So I've been able to open this. So after opening this, I'm going to pull it back a little bit so that I can now apply my sterile gloves. Here is the pack of the sterile gloves I've opened, intact. I'm going to trash this because I don't need it. So I'm going to open this. Now I've been able to open the pack of the sterile gloves. My right hand is my dominant hand, while my left hand is my non-dominant hand. I'm going to use the left dominant hand to pick the tip of the sterile gloves this way, and I'm going to be wearing that. And I'll pull this past my rib. I've been able to do that. And the next thing I'll be doing is, since this hand is sterile, I can use this to pick the non-dominant hand glove. I'll also pull this past my my wrist. So my two hands are now sterile. So I don't need this. I'm going to carefully put this in trash. Then I can put this from inside. Pull this closer. Now that my hand is sterile, I must be very, very careful in all that I'm doing. So I can now touch the pack. Here I have a pad, and the pad has two sides. The paper side will be on top, while the plastic side will be up the net. So I'm going to be fixing this under my patient without touching any part of our body. Without my hands touching any part of her body. So I've been able to fix this. Okay, that has been done successfully. I don't need this, and I don't need this either. Here's an extra glove. I don't need it. I do not need it at this moment. Here I have my iodine. going to be setting out the tray. Here is my iodine. I'm going to open it, and once I open, I'm going to pour it on the cotton balls. I've been able to pour the iodine on the cotton balls, and I don't need the remaining one, so I'm going to put that in trash. Now, I have here with me a lubricant. This lubricant I'm going to open, and I'm going to put a little here in this tray. This is to lubricate the tip of my catheter, so I don't need the remaining one. I have my forceps here, and I have a syringe. So I've been able to do this. The next thing I'll do is, I don't need this either, I'm going to take it off. I'm going to open the catheter and take off the plastic wrap, and I'll have the catheter cord. I'm going to do one thing quickly. I'm going to lubricate the tip of the catheter with the lubricant I have here. I've been able to, and I'll sit it back in here until I'm ready to use. The next thing I'll do is, I'm going to fix the 10 ml syringe, because I have to inflate the balloon. So I'm going to fix it at I'll remove the cover, and I'll put it at the injection site. So I'm going to sit that here until I'm ready. Now I am ready to clean my patient. Because my patient is a female, I am going to use my non-dominant hand to open the labia, while my right hand, which is my dominant hand, is going to be used to do the cleaning, my clean hand. So once my non-dominant hand, which is my left hand, touches the labia, I consider the hand as dirty hand. So I'm going to start by moving this tray closer. So I'm going to start. Once this hand is on the labia, I'm not going to release it until I successfully insert the catheter. So I'm going to open the labia this way. Then I'm going to start with my forceps. I'll pick the cotton balls, and I'll start from right up, downward, outer, and this goes into the trash. To the left, right, to the left, downward, outer, on the labial meatus, up, down, outer, again, up, down, outer, and the last one, up, down, outer. After successfully cleaning my client, my hand still placed on the labia, I'm going to move the catheter closer. I'm going to insert 2 to 3 inches into the labia until I see urine. I'm inserting with my clean hand. So I've been able to insert the catheter 2 to 3 inches, and I've seen urine, so I will try to insert 1 more inch. Without my clean hand touching any part. So I've been able to do that, and I can now release the labia, the non-dominant hand from the labia, because after completing insertion, the sterile process is complete. Now I will take off my hand, then I can now feel it is well inserted. The next thing I'll do is I'm going to flush the I'm going to inflate the balloon with the 10 ml syringe sterile water. So I can use the other hand. So I've been able to inflate the balloon with the 10 ml syringe. So I'm going to put that down in the box. And the next thing I'll be doing is I'm going to take off the catheter tube, and I'm going to secure it by attaching the tube to the leg right here. I'll attach it to the leg, and I'll make sure I hang the tubing bag on the non-moving part of the bed. So I've been able to do that. Then I'm going to clean the area. Before I clean, I'll make sure I take off my hand glove. I'll take off my sterile glove, and I'm going to clean the area which I work. And now, having done that, I now want to remove the catheter. So in order for me to remove the catheter, I'm going to verify the provider order to remove again. So I'll be able to identify my patient with 2 forms of ID. I'll provide privacy, and I'll play I'll put my patient in a supine position because I want to remove the catheter. Don't forget, after I complete inserting the catheter, I've been able to adjust the patient and make her comfortable in bed. Now that I want to remove it, I'm going to make sure that I put her in a supine position, and I'm going to perform hand hygiene. Then I'm going to be putting on a clean glove. I'm putting on a clean glove, and the next thing I'll do is I'll put a waterproof pad under my patient. In supine position. So I've been able to put a waterproof pad under my patient now, and I'm going to empty the urine in the tube into the catheter bag. Then I'll be able to empty the urine in the tube into catheter bag. I'll release the one I attached to the bed, to the leg, and I'm going to be using my syringe to deflate the air, the 10 ml 10 ml sterile water I used to inflate. So I'm going to deflate it. I'm going to have the syringe now. Water is coming back by itself. I will withdraw the whole 10 ml that I used to inflate. It's back in, so I've been able to bring out the whole 10 ml that I put in. Then after that, I'm going to ask my patient to take a deep breath because I'm ready to take out the catheter. So, and gently and smoothly, I'll be taking out the catheter. So, please take a deep breath. I've been able to remove it. Then I will look at the tip to see if there is anything, nothing. So I'm going to put that in my finger this way and in my glove so that there won't be any form of dirtiness. Now, after I've done this, I'm going to take off my hand glove and perform hand hygiene again, and I'll be doing perineal care. I'm going to clean the perineal area. So I've been able to clean the perineal area. Then I'll cover my patient and I'll lower the bed and I'll give her a call button and I'll educate her. If there is need for you to call me for anything, please don't hesitate to do so. In the next 30 minutes, I'll be back to check on you. I'm just going to the other room to see other patients. Thank you.